Hi, I'm Don Berwick, President Emeritus and Senior Fellow at the Institute for Healthcare Improvement. As we get to work together on the ICANN project, a mobilization project to help make health in populations get better, it might help to draw some lessons from a particular case, a particular patient. It often is helpful to do that, by the way. As a leader of change, you're going to want to think about individuals and talk about individuals in the groups that you're involved with. Let me describe a patient of mine. I've written about him, and you might read the paper that I wrote about him. I call him Isaiah. Isaiah, I first met when he was 15 years old. The scene was my clinical practice of pediatrics in the group that I was working in. And my nurse practitioner rushed up to me and said, you better get in that room, room 4. That kid's in trouble. And I went into room 4, and the kid was in trouble. First time I met him, what I saw there was a 15-year-old black teenager from a poor area of Boston lying on a exam table, writhing and yelling in pain. I didn't know what was wrong with him. I tried to sort it out and couldn't get to the bottom of it, but that night I did. The laboratory called me. They'd run the blood test on Isaiah, and he had leukemia, acute lymphoblastic leukemia. In a 15-year-old black in those days, that was a very dire diagnosis. Often kids with that problem didn't make it. But it was different with Isaiah. We pulled out all the stops, went to the mat. We gave him his chemotherapy, walked him through many, many complications over years. He had a bone marrow transplant 2 years later, and 4 years after I first met him, when he was 19 years of age, Isaiah was cured. His leukemia went away, and it never came back. A system of work came together. It involves specialists of all sorts, 3 or 4 hospitals and organizations, outreach to his home, and modern medical science. It was like a symphony orchestra, every player doing their part and walking this child through the cure, the miraculous cure of a potentially lethal disease. But I got to know Isaiah very well during the time that I was taking care of him, and there's other things I learned about him. Isaiah smoked his first marijuana when he was 5 years old. He got his first gun when he was 10. He committed his first armed robbery. He stole a car when he was 12 years old. I treated him for leukemia from 15 to 19 years of age, and during that time he was in and out of addiction, in and out of corrections. He couldn't hold a job and wasn't in school. He was failing in other ways. He blamed himself, by the way. Isaiah came in and apologized to me many times as if it was his fault, which I didn't think it was. At one point, when he was 18, Isaiah came into my office and said, Dr. Berwick, I think I'm lucky I have leukemia, because at least when I'm in the hospital, I can't be on the streets. What he meant, you would know if you visited his home, which I did many times. It was a broken down 3-decker with a vacant lot on either side in a very poor area of Boston with literally drug dealers on the corner. We cured his leukemia, but the rest never happened. And 15 years after his leukemia was cured, Isaiah died on the streets in despair, disorganized. He left a message at my home that morning, which said, as his messages often did, I can't do this anymore. It's not working. I'm in trouble. Call me. I tried, but it was too late. There was a symphony organized to cure his leukemia, his first lethal disease. But he had another lethal condition, and it wasn't cured. There was no symphony. What was it? Well, there's no one answer. I personally think it was poverty. I think it's the vestiges of racism. I think it was inequality. I think it was just a set of circumstances around Isaiah's life that, despite his best efforts, and frankly mine, we could never get organized to help with. If you were to draw a diagram, either of what killed Isaiah a second time, or what it would take to save him, it would be a pretty complicated diagram. It would involve influences on his health, his well-being, that extend way outside the boundaries of health care and health care delivery, for sure. It would involve safe streets and the corrections and public safety system. It would involve educational opportunities and how the system of vocational services might have reached out to him to help him acquire and use skills that would have built his pride. It certainly would involve the healthcare system, but also the mental health system and certainly the substance abuse system. It would have involved the environment around him, poverty itself, the vestiges of inequality in our society. It would be a complicated diagram. When we think of population health, that's what we have in mind. That's what a system is. It's a system of influences which interact with each other and with, in this case, the person we're trying to think of helping, and how that whole system works. No single piece of it, but how it works, and especially how it works together, determine the outcome for someone like Isaiah. The question I often ask myself ever since I knew him is, would he die today? And I think the answer is yes. I think that that constellation of activities that generate or fail to generate real health, real well-being, and its underpinnings, real equality, real opportunity, hasn't fundamentally changed yet, even in our wealthy society. I could tell the same story with a different kind of theme for almost any one of us, including those of us at the higher end of the income spectrum, not afflicted by poverty. When we're talking about our ability to avoid heart attacks and strokes, there'll then be an influence system of causal factors that will involve, again, a whole range of services and circumstances which interact to determine whether we're going to get well or not. This is a studied area. We understand that the influence patterns that generate health or illness are very widespread, involving a lot of interacting systems. And there are scholars among us, many of whom have been able to help in the ICANN project, who help us write down and look at, in one visual field, this constellation of influences in a so-called driver diagram. The job for those of us interested in improving health and healthcare worldwide is to think in systems terms, to remember somebody like Isaiah, and to think about how we can become leaders of the improvement of an interacting network of causes, a system, so that the Isaiahs of today might live. In some deep sense, that's the purpose of ICANN. Why would ICANN be important in today's environment? Why now? The reason has to do with the stories of patients and families and people among us whom we know or whom we haven't yet met, who are suffering because of the lack of an ability for us in society, in the helping professions even, to put together a constellation of work which together creates a symphony of effort that can create the result we want. Pushing on each separate cause separately, independently, will never get the result. Just being the best doctor or the best nurse, just being the best nutritionist or the best manager doesn't do the trick. It has to do with a collection of activities which all together can produce the result we're after. Unless we can act in systems terms together, suffering continues. And it's the ongoing toll of suffering, the taximeter that's underway right now, that I think adds urgency every day to the work of ICANN and to the work of the Institute for Healthcare Improvement, and I hope to the work you want to undertake in your lives as healers.